Hi, my name is Sarah. I'm going to show you guys how to scan the aorta. So the first thing we're going to do is we're going to prep our patient by giving them some paper towel. This is going to avoid any bit of gel getting onto their clothes. As she's doing that, we also have gloves for our own sanitary purposes. As she's doing that, we're going to show you guys the machine. So what we're going to do to start off, we're going to click this button right here called probe. We're going to select the curvilinear, make sure an abdomen, and then you're all good to go. All right, our patient's already all set up. So what we're going to do is we're going to take our curvilinear, just because that's what we use to scan the abdomen. Grab some gel. Make sure to always warn your patient if the gel is cold. If it's warmed, you should be okay. All right, the gel will be a little bit cold. All right. Just going to move our probe just a little bit, get a good image until you like where it's at. Right. That should be good. So now we're going to do, we're going to click color flow right, actually we're going to adjust it so that it's in the middle of the image. And we're going to click color flow right here, which would allow us to visualize the blood flow in the vessel. And now we have to fix this box by clicking set. And with this little ball, we move it around until you get what you like, which is within the whole vessel. Click set again to set it. All right, put it where the vessel is. And then you can use this gain button to turn it up or down, which would increase or decrease the color flow. That looks good to me. A little bit actually more. That's perfect. All right, and then we're gonna click pulse wave right here. And we're gonna center it right in the middle of the vessel. And that's gonna give us our pulse, the aorta. Right, click freeze right here, and then click P1, which would give us an image. And then click unfreeze. Click pulse wave again to get rid of it, and now we're back on color flow. There we can go, and then I'm gonna click freeze. Then we can use this little roller to roll it back and forth until you get an image just like that. Click P1, and then a little light back. You just click color flow. Again, move until you get a good image you like. The clearest right there is beautiful. Click P1 again, take an image, and that should be all. And then over here you have little adjustments, focus point, you can move it up and down. You have the gains, you have frequency, which you can move, which I actually already adjusted it perfectly. All right, and then when we're done, we can click unfreeze. What we're gonna do is we're going to wipe it down with a paper towel. Right, wipe it all down, and then we're gonna spray our probe with some of this transeptic spray, which is gonna disinfect the probe. Wipe it down again. Right. Make sure to get everywhere, including the wire as well. All right. And then you can give your patient some paper towel, so she can wipe herself down. And that's how I scan the aorta.